Alright guys, today I'm gonna go ahead and show you guys how to remember or memorize easily some specific drug suffix and drug classes. And every other day I'll post more videos like this. And if you're studying for your like licensing exams or anything like that, or if you're just a student, following our channel might will help both us, and we're hoping that it will help you guys too. So let's get right into it. So the first class to memorize is the medications that ends with azole, and these medications are usually in the classification of antifungals. I have three examples here. I have clotrimazole, ketoconazole, and fluconazole. The brand name for clotrimazole is Lotrimin, for ketoconazole is Nizoral, and fluconazole is Diflucan. The mechanism of action for these medications is they inhibit the ergosterol synthesis, which eventually attacks parasites, and like it's not allowing them to grow or reproduce. So these medications, you can remember them as with their ending azole. One of another class of medication that I'm going to talk about today ends with bendazole. It's, even though it has the thing in it, the name in it, so I just opened it to kind of like give you guys an idea, but I will come back to this in a minute. So the second class of medication that I want to talk about are those that ends with afil. These are phosphodiesterase 5 inhibitors. So three examples of those are sildenafil, tadalafil, and vardenafil. The brand name for sildenafil is Viagra, the tadalafil is Cialis, and vardenafil is Levitra. The mechanism of action for these medications are it inhibits the cyclic GMP to GMP production or synthesis, or like exchange. So it increases the GMP, and it increases the GMP, and it results in vasodilation. The next class of medications are those that ends with azocin. They are alpha-1 blockers. The three examples are prazosin, terazosin, and doxazocin. The brand name for prazosin is Minipras, for terazosin is Hytrin, and for doxazocin is Cardura. It has both immediate release and extended release dosing. These medications are antihypertensive drugs, and they are mostly used for urinary retention or enlarged prostate or BPH. The way that they work is they bind to type 1 alpha adrenergic receptors and inhibits muscle contraction. The last class is the one that I was talking about, is bendazole, and these are, make sure you guys pay attention to this class of medication. They are not antifungals, they are anti-helminthing medications. The examples are albendazole, mebendazole, and thiabendazole. The brand names for albendazole is Albenza, for mebendazole is Emverm, and for thiabendazole is Mintazole. These medications work by preventing the worms from absorbing the sugar they need for survival from their host. What like the mechanism basically makes them starve for energy, and they can't reproduce, they can't get in necessary energy for survival. Just keep in mind that these medications doesn't work on eggs. They only work on like adult, or like the other type of like worms. These, like I said, albendazole works for hydatid disease caused by tapeworms. Mebendazole is for gut infections caused by worms again, and thiabendazole is antiparasitic agent. So one exception to this kind of class of medication, which we will come across to this kind of different medication that are part of those classes that doesn't end with specific suffix. I want to give an example of piperazine. It's very popular antihelminthic drug again. the mechanism of action is a little different, but for worm related in the infections or diseases, it's also used. So just keep in mind, not all the medication in one specific class ends with the same suffix, but suffix definitely gives us an idea of like what class medication might be. So that's the four classes that I want to talk today. And if you guys like videos like this, like I said, please follow up, and I will be posting more videos like this in coming days.